Hello, everyone. I'm Mike Baird, CEO of Henry Schein 1, and I'm happy to be joined today by Rachel Nelson, who is president of our Exan group, Dr. Tanya Sue Maestas, who served as president of the American Student Dental Association in 2017 and is currently a practicing dentist at a federally qualified health center in New Mexico. And last but not least, Colton Cannon, who is currently serving as the president of the American Student Dental Association. Rachel, Tanya, and Colton, I'm thrilled to be with you today to talk about the future of interoperability between dental and medical electronic health records. I know this topic came up for both of you, Tanya and Colton, during your respective conversations with Stan Bergman, and I'm looking forward to continuing the dialogue today. What does interoperability mean to you? How do you define it, and why is it so important to the practice of dentistry? And to start, I'll hand it over to Tanya.
Yeah, thanks so much for having us here tonight. I think that this is really exciting for us to kind of share our ideas and vision and, get Colton's perspective as a student and my perspective as a new dentist and what that'll look like in the next few years. But, interoperability is, when you think about it, an opportunity for us as providers, as dentists, to see a patient and their whole being, to get their whole story. One of the benefits of working at a FQHC is I have the opportunity to work alongside a lot of our medical providers in the building right next door to us. So that opportunity to see and work with those providers and understand that our patients are not only seeing us, but also them, allows for us to communicate about our patients. And it's also a great way for us to kind of look at their EHR. We use ECW here and look at their records, check on their A1C. Most patients come in and they don't know what their A1C is, and that is crucial information for us to know. So it's small stuff like that that is really, really convenient. And I can see that the future of medical and dental and that interoperability include that and be a standard across the board.
As we learn more about how integrated medicine and dentistry are and how the mouth is really part of an overall picture in the overall body, as a student, we learn so much about how connected the body is, and we learn so much about diagnosis and be able to have good clinical care. I think interoperability is having the framework and infrastructure in place for you to make those best clinical decisions with the most accurate and up-to-date information and not have to be wondering about certain facets. You can really have the ability to be able to see the information you need, see the information required for you to make an educated clinical decision.
That's fantastic. Rachel, I'm curious if you have any thoughts as someone that's worked in the space for many years.
Well, I feel like I just want to steal what Tanya said. I love that. It's telling a story. And I really think the power of data really is what we do with it and how we use data to tell a story. So I would probably expand on that to look at, what sort of data should we be sharing? What is relevant data? Do we have standardized data to make this more accessible and easy to use? And so when I think about interoperability, I'm thinking usually more into the data side of it. And how do we make that as easy as possible that providers have the appropriate relevant data to make the best clinical decisions? And really all it is being able to share that information across systems.
I really like that.
Say, Tanya, I'm actually curious, just to follow up on your point. You work at a health center, and so you have easy access to records. Is it just as applicable if you're in a regular dental practice?
I think it's applicable. I just don't know if it's being used at this point. I think that the direction is headed that way, but I don't think that there is a opportunity for many dental providers to check in on their patients' medical records. I think that there are some systems and some EHR records that are allowing that now, but I don't think that it's the standard quite yet. I hope that it does become the standard of care one day, because I think that's the best way to truly treat a patient. And it's funny, we talk about the story and patients come in with their stories, but sometimes they don't have the whole picture or they bring in their understanding. So to see kind of the backside of things and what they're doing with their physicians is really, really helpful. It really is nice to work here, because if something kind of goes south or I have a question, I can just run over next door, and that access to have a medical provider there, kind of be there and have that fail safe almost, is really, really reassuring to me and to my patients.
I think Tanya made an excellent point about telling a story. When we approach a patient, they have a story, they have a medical history, and they have a dental history. And to be able to not put the entire burden of being their own medical historian on the patient, but really to use sound data, and allows us to make those clinical decisions. I think once you have that information, you're able to know the patient's story, know where they've been, will allow you to be better able to know where they're going. And I think that's really, really crucial for us in dentistry, is to be able to have that interoperability. As Tanya works at an FD, she has the ability to have a medical colleague just down the hall if she has a question. But I think be able to have the data and have the infrastructure in place where that information is easily relevant and easily presented to the dental counterpart will allow the exchange of information in order to have a more seamless and comprehensive care model, and not have to put the burden on the patient to be their own medical historian when coming into your practice.
I'm curious, Rachel, both of the people here have talked about how when you're in an environment where healthcare and dental are so closely related, so when you're at a dental school, for example, many of them are co-located with the medical school as they see patients, or an FQHC, as we talked about earlier. And from the Henry Schein One side, you work with dental schools, so you were probably at the forefront of seeing interoperability in practice at many of these clinics. From a technology perspective, I'm curious what you think some of the roadblocks are to interoperability.
Yeah, I think the roadblocks, we're on a journey. I think as a profession, and so even when we talk about, what are some of our goals, we really make the goal expanding interoperability, because I don't see it as a fixed target. I think that, what I've seen happen in the last 10 years, a lot of it originally was, do we have standardized diagnostic codes? And 10 years ago, dental schools weren't using standardized diagnostic codes. And that almost actually became the first benchmark on how do we play in this interprofessional environment when we don't even have standardized language. And so seeing progress happen in that way. And then, with a lot of states expanding to saying we're requiring that you do electronic prescriptions. Great. What did that give us? Well, automatically, if you're using electronic prescriptions, you're able to, within any EHR you're using today, upload alerts, allergies, medications, prescriptions, just through, your dental EHR. And so that kind of was, I think, the beginning stages of it to what we're seeing today, which is it's expected that you should be able to use your software and pull in actual medical data. And that's not only, I think our opinion on it, but it was actually legislated by the government. So there's legislation that's supporting this, that systems should talk together. And we're seeing a lot more activity within this space. So whether you're going to a consolidated record or whether you're saying we want to use the best in breed within dental software, and having our systems talk to whatever your medical record is. And I think we're now seeing the movement even into, we don't have a federal medical record, but we're seeing movement in that space to saying, if there is national or state records, can we actually talk to that? So we're not even pulling data from a single hospital, but we're looking at within the state, can we pull data across multiple medical records? So that's kind of, I think, where we see this going. But again, I don't know if I believe there's an end target in this. I think it's constantly expanding, and that solves one piece of the puzzle. But a really big piece actually is, what is relevant data? And, we talk, I think on the dental side, there's a hunger for access to medical data. You talk on the medical side, there's physician burnout with the amount of data that they have that they don't know what to do with. On every day that someone is in the hospital, on average, you're seeing 8 to 14 lab tests per day that you're in the hospital. Is that relevant? Imagine the amount of time it would take to go through every single access piece of medical data before you could treat your patient. It's not realistic. We need to have a summarized view of relevant data to properly and accurately treat our patients. I would love to see some sort of benchmarking around what does best practices in this space look like, so it's standardized. We have some form of that, again, through federal legislation, but I think it has not been built out through a dental lens, which is really, really important. So again, I think there's progress that's being made. We're directionally correct, but there is definitely things that prevent us from doing this, I think, the way we want it to be, but we're going in the right path. Did that kind of answer the question?
One of the things that I would add to that, if you think of a standard dental practice and they're seeing a patient, well, what is that patient's healthcare record? And I totally agree. There's definitely an information overload, right? Do you want 10 years of a patient's history, or do you just want to know that they have cardiology issues that you should be aware of, and certain medications that they're taking, and sort of figuring out the right filters on that is certainly a challenge. Colton and or Tanya, I'm curious if any of that resonates with you. Do you see some of those similar roadblocks in your day-to-day practice?
Yeah, absolutely. I think knowing what the important data is crucial. Time is very valuable to any provider, and be able to spend the time to be able to ask the right questions and to be able to spend the time giving your patient care is ultimately the benefit. So the less time you have to spend sorting through the data, the less time you have to look for the questions you need to ask, the better off you're going to be providing that care. We all know that we live in a data-driven world right now. Yet being able to find what's important and being able to have the systems in place to be able to direct you to what's important, I think is crucial in your ability as a clinician to ask those questions and then follow up if necessary.
That's very well said. And Colton, you know that as a student, time is really of the essence, especially if you want to get all your requirements done and graduate. But, I will say that you can get that information overload, and it can be almost like playing I Spy to figure out what you're looking for, what's pertinent, what's most important to you as a dental provider. So that can be a little bit difficult. So finding that streamlined, some way to kind of extract all of that would really be best and help kind of move appointments along.
I'm curious, Rachel, because you see many entities that are doing this today. What does success look like?
I think success looks like when you consider the entire workflow. A lot of times we think purely on the technology side. So we think, does the data pull into our system? I think taking a step back and actually thinking, how do we want this part of our patient experience at the dental school? And so whether that's how you're screening your patients, how you incorporate your medical health history, how you're teaching your students to review this data. So taking a bit more of a holistic approach to what role does medical play within the healthcare ecosystem that we're serving in, is probably where I would guide our customers to go towards, as opposed to thinking it just purely as the technology or the infrastructure piece to it, which is very important, because if it doesn't do what you need it to do, you're not going to be successful. But I think that's only one piece of a bigger part of the puzzle.
I'm curious again, and Tanya, we'll start with you. Are there any particular stories or things you've seen where you've seen benefits to having access to that total health profile on a patient?
I hate to go back to the A1C scenario, but it's huge here in the community and those that we serve. Diabetes, the prevalence here in the borderland is very, very high. So knowing somebody's A1C, knowing if they're on a bisphosphonate, knowing if they're on a blood thinner, where many patients may come in and not know what their health history is. They know that they take medications, but they may not know what they take. It's really, really crucial to know that. At many FQHCs, health literacy is not very high. And while we do our best to educate our patients and they do their best to also learn alongside us, oftentimes they may not know why they're taking certain things. So that is a really big benefit for us to be able to go through all of that and ensure that anything that we're doing to our patients, we're not causing harm. So if we're going to extract a tooth, we want to make sure that, they're not going to go home and bleed out and cause more issues, because we want the safety of our patients to be a priority.
I think Tanya answered that fantastically. So many of our patients face numerous different challenges, whether they're perfectly healthy to on the other side of that spectrum. Being able to have that information as a provider allows you to make better dental choices that might impact their overall health. So I think from a public health perspective, the more well-versed you can be in what the situation that particular patient is going through, the better educated your dental decisions can be, and the overall greater effect you can have on influencing the patient's oral health and overall well-being.
So if you could change what interoperability looked like, where would you like to see progress over the next 5 to 10 years? What are the things on your wish list?
I think it goes back to what we were just speaking about, making it streamlined, finding a way to where when you look at somebody's chart, you have what you need right away. And sometimes you have to dig, and that can be time consuming. So, I don't know how any of that is done as far as software goes, but trying to streamline that and making it for just user friendly so that way everyone can kind of just jump in and get what they need.
I think, being able to have the information you need and be able to use that information appropriately and relevantly. The last thing you want to do is have to dig for information in front of your patients, go chase down different records, go try to figure out what medication exactly your patients are on. I think being able to have that information presented right forward to you not only improves your ability to act as a clinician, but also improves the experience the patient has with you.
So Rachel, is someone that's working on, software like this, where do you think the progress will be made over the next 5 to 10 years? And how are you going to bring that vision together that Tanya and Colton so eloquently laid out for us?
That is a good question. I think what I love that I thematically have heard through all this, like we're talking about the concept of interoperability, but when I go back to, I think Tanya's first comment around storyline, what we're actually talking about is patient-centered care. How do we see the whole patient when they sit in the chair? And we're not seeing just their head, we're seeing the whole patient. And I think that's where the future is. And so there's aspects around how does this work within the medical ecosystem, but there's other aspects actually. There's aspects about how does the patient engage with their own record. And Mike Baird, you know better than anyone else that we're super passionate around patient communication. How do we have patients having access to their own data? It shouldn't be something that they don't know and they don't understand. How do we make it more relevant to them? So I think there's multiple pieces here. One, it's bringing in that relevant data again into the clinical record, so we have access to important information that we need. But actually, how do we then share that information so that dental visits are bigger than one-stop shop, right? It's where, we look at Apple Health. A lot of people wear, we track our steps. There's really cool things happening in the dental innovation space around, Bluetooth toothbrushes, being able to have apps and track all of that. So I think there's actually a lot that's going to happen within consumers driving their own personal health records as well. And that to me is actually really exciting and passionate. And I think when you look at, what's happening in terms of technology, where we're seeing that the consumer is more powerful than ever. And so we're going to have it on both sides. What role do we play in terms of accessing that information? But then what role does the patient play as the center of their own healthcare record?
Those are some great thoughts. A few just to add to that. I love the way you brought up consumerization, and I think that tends to end up solving these problems for us. So on the one hand, particularly in the United States, I'm not certain we'll ever have a singular patient healthcare record or registry, though I do think we'll see various standards that help make it easier. So we're seeing the rise of standardization through things like Care Equality or Commonwealth, where they're trying to build common data standards to make it easier to exchange information. But even in that instance, right, where a patient interacts with so many different healthcare records, it can be a challenge to find which one to integrate with. I actually think the consumer will end up solving that. I think you brought up, Google and Apple Health, some of the platforms that they have there, where if you think about how easy it is to decide today to share your sleep data or your weight data or whatever it is with whatever apps you want to, I almost wonder if the consumer becomes the consolidation point. And if that patient is actually syncing the relevant data from the various, medical providers that they see, or the various medical tools that they gather data on, and then when they work with a dentist or other healthcare provider, they can choose, what to share. And in a future world, you can imagine it being as simple as a dentist being able to say, well, I want to know your major things and your health history and maybe your most recent prescription data, but I actually don't need everything from, when you were 5 years old or whatever it may be. I actually think that we end up finding a lot of those solutions, and I hope we'll build off of that. I think the other big trend that I think will help is data is turning from the inside out, meaning instead of it being captive in thousands of little databases everywhere, most platforms are opening up an API, which is basically a plug-in model that makes it easier for other sources to get to that data. And I think those trust relationships will be built across most platforms. They're built that way natively. If you look at the way Amazon works or Airbnb or other consumer platforms, they're built with these open access points to gather data. And so I think we'll see that trend throughout these various databases, whether it's an electronic healthcare record, whether it's your dental record, whether it's other things to make it easier to share. So I'm very optimistic that we'll see the industry continue to evolve in that way, and that will ultimately result in better care, as both Colton and Tanya have discussed. I would love just to get closing thoughts. If others have other thoughts they'd love to share on this topic, and maybe as we go around, I'll start with Colton this time, and then we'll go to Tanya and then Rachel. Any other thoughts you have about the way you see interoperability and the promise of it in the future?
Yeah, I think kind of from a student's perspective, we're constantly learning new things. We're becoming more and more integrated healthcare providers and more well-rounded with technology than generations before us. When we enter out into the profession, we have a desire to have that information be able to be present. And I think it's exciting for new dentists and exciting for students as well to be able to put all those pieces together and being able to truly see how so many various aspects impact a patient's health. And I think like that's something that makes me really excited. And I think that's something that interoperability can play a huge role in, is being able to put those pieces together so clinicians can have that great viewpoint. And I think students and new generations of dentists are really looking for that, and they're really desiring that. I think that's going to be a great push to be able to have more kind of sharing of data, sharing of records, and be able to have that more streamless care.
Tanya, what do you think?
Yeah, technology in dentistry is so exciting. And to see different softwares and technologies come out to help that interoperability is also very exciting, because I think that, we're going to streamline that process for both the consumer and for the patients. So I'm excited to see, what comes out in the next few years, what gets integrated in different places, and what role we can play as the millennials and the new dentists in this world to influence some of that change into the future.
Rachel, what do you think?
I think I'm just echoing what everyone said. I think there's never been a better time to be in the profession. I'm so passionate about what I do, because I always say, like, the intersection between healthcare and technology, like, is the coolest thing. We get to do things that are fun and interesting while making a difference in the world. And so I'm inspired by meeting with the future of the profession. I thank you for your insight and your time. But yeah, this is an exciting time.
I think those are all great thoughts. I love that both Colton and Tanya used the word excitement in what they talked about. And Rachel, you talked about passion. It definitely is a time of great change in the industry. And I think it's great to see the passion that you all bring to the discussion. And I think I would encourage anyone listening to it to contribute their thoughts to the discussion. I think this is one of those things that the market evolves based on the demands of patients and the insight from dentists on ways to deliver care in a better, more comprehensive way. And ultimately, healthcare has a way of upgrading over time. We get better and better at doing these things, and we have much better patient results. So really appreciate Rachel, Tanya, and Colton for your contributions today, for the thoughts you're bringing to this, not just in today's dialogue, but as an ongoing conversation in the industry. And really appreciate your thoughts. And thanks to everyone that listened in. I hope you have a wonderful day. Thank you.